Hello, hi, thank you for joining me. I am Dr. Erica, back with you again for another video chat. Please like, share, and subscribe. Visit my website, themillenniumpharmacy.com, for shopping and for medical devices, over-the-counter medications as well. Today's topic, as you can see in the title, is called Four Drug Classes That Actually Cause Weight Gain. And it is popularly known, and laboratory tests are conducted at baseline 1 month, and after so many um, times at 1 month, 3 months, 6 months, and then maybe annually, depending on the time frame. So the first medication class that I'm going to talk about is the anti-epileptic or anti-seizure medications. That's your Tegretol, that's your Trileptal, that is your medications that help with seizure control and maintenance. Okay, so that class is known to cause a weight gain in patients, and so patients will be weighed at baseline and periodically to make sure that the medication is not causing side effects such as glucose intolerance, because we know gain eventually causes glucose intolerance, high blood pressure, high cholesterol. So, in order to prevent that in these particular patients, we want to make sure that their weight is within range, in proper range. Okay, then the hormones. Hormones, those drug classes will include your estrogens, your progesterone, your insulins for diabetic, anti-diabetic medications. That class of those classes, and they contribute to the hormone class that causes weight gain. And because those classes cause weight gain, it's important that patients are weighed periodically and they monitor themselves throughout the actual duration of therapy. Estrogens are used for oral contraceptives, used for regularity of other hormones in the body, in the female body, and also it helps with just with regulation and postmenopausal symptoms. So it is very important for patients who are over the age of 35. Women who are over the age of 35 should maybe make sure to speak with your healthcare provider on a regular basis to let them know how you're feeling while using estrogen, because estrogen not only causes weight gain, but it also causes blood clotting, causes cancer, causes tenderness in muscles. So do be aware that it causes headache. So do be aware of those side effects. In particular for this video, the weight gain, because we know that with estrogen, the weight will increase. And as you can see with some patients, you may notice within yourself or other patients that they really begin to cause weight around the facial area, within the torso of the body as well. So do be aware of that. Progesterone is also another hormone, a natural hormone, and it is also included in oral contraceptives as well, and for regulation of the female cycle. So that is another hormone that causes weight gain. Insulin products. Insulin is used to help with the reduction of glucose, hyperglycemia or glucose intolerance, and also insulin is used on a daily basis and throughout the day. And over time, if the patient is not exercising properly or eating properly, that weight gain can go through the roof. So we want to be sure that, in particular with insulin, estrogen, and progesterone, that we are being very careful with giving those medications and consuming them on a regular basis. Antidepressants. Antidepressants is a third class of medications that cause weight gain, as we know so far. Antidepressants are going to include your mirtazapine. It's going to include your amitriptyline. It's going to include medications like the Paxil and the fluoxetine. Those are your antidepressant classes. And with those, patients should weigh themselves regularly, maybe daily, at home, to be sure that they're not gaining weight so much that that is noticeable or is causing an effect on their heart or their glucose levels and cholesterol as well. So, like I said earlier, most doctors' offices will set up appointments with you to make sure that they have a baseline weight for you, they have an ideal weight for you, whether you're obese or underweight or average weight or extremely obese, they'll have an ideal weight where you should be. And they also measure your waist circumference, uh, the body mass index as well. They'll measure that and make sure that those two indicators are indications of life expectancy, life outcomes, quality of life as well. Antipsychotics, those are your medications like your clonazepam, your Seroquel, your olanzapine, um, your medications that help with the mental state, such as schizophrenia, bipolar, um, any type of mental disorder where there is a sort of psychosis that may be happening. Those patients may be placed on a medication or multiple medications that cause weight gain to help control the mental status. So those medications, like I mentioned earlier, will be your Seroquel, your olanzapine, your clonazepam, your Paxil, things like that. So be aware of those medications for schizophrenia, bipolar, and uh, and other mood diagnosis. So, with that being said, those are your four classes: your hormones, your antidepressants, your antipsychotics, and also your anti seizure medications or anti epileptic medications. Now, there are two medications that I wanted to make mention that do help with weight loss in patients who may not be taking these four classes of medications but are interested in weight loss in general because of their obese or weight status. Having a BMI greater than 40 is an indication of a patient who may be a qualified patient to take one or two of these medications. After so long, 6 months of um, adequate exercise, 6 months of adequate diet, 6 months of behavior modifications, and no change in weight, then these one of these two medications may be rendered, and that is the Phenermin or Adipex P. I have a video on this as well, so do please visit that video. I'm just going to make mention briefly about that and some of the key points. It's used for short-term use, and the max dose per day is usually 30 milligrams per day. But there's really no effect at the 30 milligrams. So patients usually start and continue at 15 milligrams once daily in the morning. And in the morning, because it has a side effect of insomnia or lack of sleep, so it is recommended that patients take short-term Phenermin or Adipex P 15 milligrams every morning, and the mechanism of action is that it suppresses the appetite. It suppresses the appetite in the cognitive lobe of the brain, and it is usually not covered by pharmaceutical insurance. It's usually an out-of-pocket cost prescription. So do be aware of that. Once you get your prescription, take it to the pharmacy and speak with your pharmacist about any coverage that might be available on a GoodRx card or a discount card or pharmacy card that they may have available for you. But like I said, it's usually not covered by the insurance companies. The second medication I want to go over is Orlistat. Orlistat is available over the counter as well as prescription. You can pick it up over the counter in your dietary supplement section of the pharmacy department, and the dosing is half of that, which is of the prescription. So it's 15 milligrams given. I'm sorry, 180 milligrams, excuse me, 180 milligrams at the over the counter version of the medication. It's OTC at 180 milligrams, and then it's prescription at 360 milligrams. Divided doses, usually 3 divided doses per day. And it is long term versus the Phenermin. Long term use is okay with this particular medication. It reduces the absorption fat in the GI tract. That's its mechanism of action, that how it works. So if you are maybe intolerant in your GI tract, or you don't feel comfortable taking a medication that works in the GI tract, do speak with your provider for maybe an alternative medication such as Phenermin. And I do see Phenermin prescribed more often because Phenermin works effectively at 15 milligrams every morning, once a day. It's not divided doses; it's a once a day dose, and most patients do come off of it over a period of time. I don't see any long term use with the medication, so I do would recommend that. Okay, and orlistat again is long term use. It comes in 360 milligrams prescription, or it comes in 180 milligrams over the counter. So do be aware of that. And it's over the counter as Ali, ALLI, Ali. And then the prescription is going to be called the Xenocol. And those are the two medications that do cause weight loss in patients who, again, have failed attempts over a period of 6 months of adequate diet and exercise, and then who have also changed their behavior modifications, such as tobacco use, because we know tobacco use does cause increase in heart rate, increase in blood pressure because it clogs the arteries and the very important veins that help pump blood. So we do know that much. So you want to consider one of the two in those cases. But if you're on one of the four that I mentioned for weight gain, do make sure you're being tested and your weight, circumference, and body mass index is being examined on a regular basis. And most nurses and doctors will make sure of that. So once you make your doctor's visit, just be aware of your weight, and I would make sure that I'm getting a tally of my weight as I am actually receiving those monitoring points. So that is all I have for today, and I thank you for joining me. Please join me on the next video chat. If you have any questions or comments, please leave them in the section below, and I'll be happy to get back with you. Thank you for joining me. Have a good day. Goodbye. Bye-bye.